Welcome to Care Conversations, a series by Purple Global Mission and MyCare Assistant exploring the ideas, systems, and innovations shaping the future of care. As we build toward the CARE conference in November, we are asking an important question. How do we build care systems that are not only digital, but intelligent, responsive, and deeply human? Today, we are exploring adaptive artificial intelligence and what it could mean for care delivered in people's homes. And joining me is Toyin Aguda, co-founder of Sooko AI and former vice president and AI research lead at JP Morgan Chase. Toyin, let's begin with the basics. What exactly is adaptive AI?
The easiest ways to understand adaptive AI is to compare it with traditional rule-based systems. Imagine that a monitoring system has been programmed to trigger an alert when a patient's blood pressure exceeds 150/90. Today, the patient's blood pressure is 142/88. According to the rule, everything looks fine. But what if that patient's blood pressure has consistently averaged around 118/76 for the previous 90 days? Suddenly, 142/88 means something very different. That is where adaptive AI becomes powerful. Instead of asking only, has this patient crossed a predefined threshold? The system can also ask, is something changing from what is normal for this particular person? Adaptive AI continuously learns from patterns. It may look at blood pressure, glucose, sleep, movement, medication timing, and other observations together. It begins to understand relationships between those signals. Perhaps someone's glucose changes when their sleep deteriorates. Perhaps their mobility starts declining several days before another symptom appears. The important thing is that the system isn't simply waiting for one number to become dangerous. It is looking for drift.
So the number may be within a population level threshold, but abnormal for that particular person. And this becomes particularly interesting in home care because we're observing people over time, not just during one hospital encounter. Let's bring this into everyday care. Suppose I have an older person receiving support at home. How might adaptive AI help with medication adherence?
The system can learn when an individual normally takes their medication. Imagine they usually confirm their medication between 8 o'clock and 8:15 every morning. One day, 8:30 passes with no confirmation. Instead of waiting until someone eventually notices, the system could recognize the deviation and prompt the caregiver. We're moving from simply recording what happened to identifying when something expected hasn't happened.
So we're moving from simply recording what happened to potentially identifying when something expected hasn't happened. Another fascinating application is caregiver matching. In home care, compatibility can affect the quality of information we receive from a patient, which reminds us that good matching isn't simply about finding an available caregiver, it's about finding an appropriate caregiver.
Imagine an older Igbo-speaking patient who is much more comfortable describing pain, discomfort, or emotional distress in Igbo. Matching that person with an Igbo-speaking caregiver may improve communication. An intelligent matching system could consider language, cultural context, preferences, competencies, and previous care interactions. Good matching isn't simply about finding an available caregiver, it's about finding an appropriate caregiver.
Now, imagine an organization supporting hundreds of people at home. Several patients need attention at the same time. How could adaptive AI help?
One possibility is dynamic risk scoring. Instead of treating every request as identical, the system continuously evaluates available information and helps identify who may require more urgent attention. That can support scheduling and caregiver deployment. It can also support triage. A person can have a severe chronic condition and still be stable. Another person may appear relatively well, but show a small, unusual change that is significant for them. Adaptive systems can potentially help distinguish between those scenarios.
So sometimes the most important signal isn't the loudest signal. Caregivers also generate enormous amounts of information. They observe appetite, mood, sleep, mobility, wounds, medication, and family concerns. Much of that information may be contained in notes or even voice recordings. That turns documentation into something much more useful, a source of structured care intelligence. But adaptive AI can't know someone's normal immediately. How does the system establish a baseline? This raises an important issue for Africa: data, because intelligence without context can still produce the wrong answer. Now, to the question many healthcare professionals are asking, will AI replace us? I think that distinction is essential. And what happens when AI gets something wrong? Because it will. So the objective isn't removing humans from care, it is giving humans better tools for seeing, understanding, and responding. For a nurse, caregiver, or healthcare leader watching this and thinking, this sounds sophisticated, where do I start? What would you recommend?
Now, one of the questions healthcare professionals frequently ask is whether AI will replace them. It won't. AI cannot hold a frightened patient's hand. It cannot replace human presence. It cannot fully understand every cultural or emotional expression. And it cannot carry professional accountability in the way a regulated healthcare professional does. AI can support decisions, but professionals remain responsible for decisions. A useful principle is AI suggests, professionals decide. There will also be false positives and false negatives. When the system encounters something unusual or gets something wrong, we need to understand the external factors involved. Was this an edge case? Was important information missing? Was the context different? Humans can correct the system and expose it to better examples. That is why we talk about the human in the loop. The relationship should be one of co-creation. The objective isn't removing humans from care, it is giving humans better tools for seeing, understanding, and responding. So, where should a nurse, caregiver, or healthcare leader begin? Start with prompt engineering. Healthcare professionals already possess many of the underlying skills. You observe, you document, you communicate context, you identify what matters. Prompt engineering requires similar discipline. Describe a scenario clearly without including personally identifying patient information and ask AI to help you think through it. Be specific. For example, create a care plan for an 80-year-old bed-bound patient living at home with a stage 2 pressure ulcer. Then provide additional relevant clinical and contextual information. Different AI models may approach the problem differently. With Sooko AI, we can run the same prompt across multiple large language models. The synthesizer can then produce a unified summary, while brainstorm mode can help professionals explore gaps or alternative approaches. But the output must still be reviewed by the professional. AI is supporting your reasoning, not replacing your clinical judgment.
This connects directly to the work we're doing through the home care framework. One of the tools introduced in the book is the Safe Care Score. It begins as a practical manual scoring system, but we're exploring how it can evolve into an adaptive AI tool. The larger question we're asking is, how do we move home care from fragmented observations to measurable, intelligent, and accountable care infrastructure? The home care framework contains several practical tools designed around that challenge, with the full release targeted for September. And this conversation does not end here. In November, Purple Global Mission will convene the CARE Conference, bringing together healthcare professionals, policymakers, technology leaders, investors, and other stakeholders to examine how we build the infrastructure required for safe, coordinated, and sustainable home healthcare. Digital health and care data systems are a critical part of that conversation. But technology alone is not the destination. Better care is. Toyin, if people remember only one idea from today's conversation, what should it be?
If there is one idea to remember, it is this. Don't think about AI simply as automation. Think about how intelligence can help us understand the individual better, and always keep humans in the loop.
I love that. Perhaps the future of care isn't human versus artificial intelligence, Perhaps it is human intelligence, clinical judgment, and artificial intelligence working together, because ultimately technology should help us recognize what matters earlier, respond more intelligently, and preserve what makes care human. Thank you, Toyin, and thank you to everyone joining this care conversation.